welcome to HCS Connects. I'm your host, Kelly Gorel. Today's episode is going to bring you information about how we are opening for the 21-2022 school year. And with us, we have our Director of Health Services, Glory Gill. So welcome to HCS Connects, Glory.
Thank you.
So we're almost here. It's almost time to bring back our students and our staff. So what's that going to look like?
Well, it's going to look similar to what we had last year with just a third of our students were back, I think, maybe a little bit more. We'll have virtual as well as in-person students. Hopefully we'll have a lot more in-person students this year, so I'm looking forward to that. Otherwise, just a busy time, I think.
Very busy time.
Very busy time.
Now, you mentioned in-person and virtual. So this school year will look a little bit different. I know last year we had hybrid option. We had some students that were in school only 2 days a week, some that were fully virtual. But in our primary mode of teaching and learning this school year is 5 days a week in-person learning for our students.
Correct.
And then if our families do want that virtual option, we offered Virtual Virginia, which means that they're still a Hampton City Schools student as far as participating in extracurricular activities or sports, but they're actually taught through Virtual Virginia with their teachers, and they actually begin at the end of August, a little bit before us.
Correct.
They have a different school calendar.
They're already pretty soon to start.
So when I say what's this going to look like, and you said it's pretty much going to look like last year, explain some of those mitigation strategies that we had in place last year that we're just going to keep on rolling with this year.
So we basically had several health mitigation strategies. We had the masks. Everyone wore masks when we were in school. We had distancing. Last year it was 6 feet. This year we're going to be going to 3 feet, with hopefully having some variations depending upon whether you're in a classroom or in the hallways or various things like that. We're going to have desk shields. That will continue. Every student will have a desk shield. We will also have air purifiers in every single room, the classroom as well as even a lot of the offices. That is very critical in making sure that we've got good airflow and good circulation. We will also have extensive cleaning throughout the basic cleaning in the daytime, but at nighttime they'll be using some atomizers and really cleaning up the whole areas where all students are as well as staff. So it's really, I had a physician explain it like it's like Swiss cheese. You have layers of Swiss cheese, and each one sort of protects you even further with all the health mitigation strategies we have. So I think that we're well prepared for being in school at this point, and we did a great job last year, and I really anticipate doing the same thing this year. We also, I forgot to mention, we do health questionnaires. That will be critical in making sure that students come to school that are healthy. So parents and staff. Well, I haven't gotten to them, but I thought I'd start with the parents first. Making sure that when you do the health questionnaire in the morning, we don't need a copy sent to school, but we do want you to go through the list, because if they have any of those symptoms, it is better to keep them home, talk to the nurse, see if what's going on, see if we advise to talk to your provider and maybe even get tested. Same thing, yes, with the staff. The staff, it's critical as well. You're not feeling well, stay home, call the supervisor, call the nurse, and then let's go from there. That's like the very first step. I should have started with that because that's so critical. If you don't show up to school, we don't have to worry about all the other things because you're staying home because you're not feeling well. And then the teachers also will continue the posters that we had in each classroom, where they just go through in the morning asking if anybody has any of the symptoms. We realize that at the beginning it's going to be, oh yeah, I think I have this, this, and this, and we'll go down to the nurse and get checked out. But overall, it's just another part of that mitigation plan so that we're keeping the school healthy. Swiss cheese.
Well, and like you said, these are mitigation strategies, health and safety mitigation strategies we had in place last school year.
Correct.
And we're able to really look at what worked and what didn't work and fine tune that.
Correct.
And we're starting that the same way this year. Mm-hmm. We had the health checks, those wellness checks that we asked families to run through with their child before putting them on the school bus or arriving to school. Mm-hmm. We asked all of our staff to do that. So, and we had lots of different calls to school nurses if someone didn't feel well, even with the sniffles, just to be proactive instead of reactive.
Great participating in a team effect. Our parents were part of that team, and it was so important to have that.
One of the changes last year that we're still putting in place this year, though, is if a student or a staff member has a fever, We've extended that a time that it has to be
Correct.
72 hours fever-free without medication before coming back to school.
Correct, and that will continue, just to be on the cautious side, because fevers, as you well know, can fluctuate anyway, but also with COVID, we just want to make sure that we keep everybody healthy and safe, and certainly fevers are one of those fluctuating things.
So we're starting with that wellness check in the morning. Everyone is masking up as they get on a
Correct.
school bus. That is a federal law.
Federal law,
because
yes.
that is public transportation.
Correct.
When they get to school, we're still asking everyone to be masked, whether they're vaccinated or not, as that is the CDC recommendation currently.
Correct.
And we are abiding by the CDC regulation. And if that regulation changes, we will then also monitor, our mitigation strategies, at least by the first 9 weeks, to see,
Correct.
what we need to tighten, what we can make a little less restrictive, and so forth. Is that correct?
Correct. And I forgot one other additional thing that we didn't have when we first started as much, is now one of the encouragements that we do say is, if you're able to be vaccinated, be vaccinated. We know that there are people out there that cannot be vaccinated because of medical issues or disagreement with things. We're not mandating this. We're just encouraging as many people that can, because that is one of the ways to help mitigate some of the COVID concerns that we have right now, especially.
Well, and that's a great leadway into talking about, those health mitigation strategies we had last year and what we're bringing into this year. So last year, if we had a positive case, we did thorough contact tracing.
Correct.
And will that resume this year?
Yes, that will resume this year. All of the nurses have been trained to do contact tracing, and we're reinforced through VDH, the Department of Health in Virginia, and so that will continue. And what that entails is basically we're going to, as soon as we know that a student or a staff member has positive for COVID, then we start asking who were they around, who did they sit close to, with children especially, who is in their circle of friends, because if they spend a lot of time talking to them, even with your mask on, if you're within 3 feet or closer, there's a potential for getting COVID that way. So certainly we'll do all those questions. We also do check, as part of our ability as a registered nurse, to check the Virginia immunization system to see if in fact did the person have a COVID test. Then I know that I don't have to quarantine them unless they're having symptoms, where I do have to quarantine those that don't have a vaccination, because that's part of the CDC's requirement.
So if a staff member or a student that's 12 years or older is fully vaccinated and comes into contact with another positive person, there's less likely of a chance that they would have to be quarantined.
The biggest thing that we're looking at with the different variants that are out there is if they have more respiratory issues. That's probably our most critical symptom that we're looking at with any of the variants, is that if you have a cold already, we're going to have you quarantined, not because we think it's COVID, but you need to be checked just to make sure.
So promoting vaccination, highly encouraging that, but also all those other health and safety mitigation strategies in place, the masks, the desk shields, the partitions, staying a minimum of 3 feet of distance when possible.
When possible.
We know that bringing back, close to 19,000 students 5 days a week, it's not going to be possible at all times, but those other safety and health mitigation strategies, that Swiss cheese, will help assist in that. We definitely have the enhanced cleaning during the day and the evening. We've seen that in our buildings. They look great, and Dr. Bowling's office has been wonderful in assisting if we have a presumed COVID case in that.
The nurse actually will contact him to let him know that we have a case in a particular room, and they'll do an extra cleaning. It's even more specialized, if you will.
Now, we are allowing parents and visitors back into the building. It used to be by appointment only last year. Now it's not, but we're still asking our visitors to abide by those rules. If they're not feeling well, to not enter the building, wear a face mask, go straight to the office. We're not allowing parents and guardians and visitors to eat lunch yet with our little, sometimes like to go
that is a difference in what the school year will look like compared to other school years, is that we're still not allowing the parents and visitors to come down to eat lunch with them, go to the classrooms, and it's just protection of our staff and our students at that point. I'm hoping that soon we can relax some of that, but at this point we really have to be protective for the whole, not just 1 or 2 people.
One thing we also did last year was our dashboard, and that was part of our communication and our transparency. And so we'll continue to maintain that on our HCS website again this year. We are going to start over the first day of school. We've been maintaining it all of last year in the summer school to have those numbers increase if there's a positive case. But we've been pretty low as far as the number of employees and students that have been in our building since students came back in January in regards to if you really look at the number of COVID cases.
We really have been very good, and I know that that is based on the fact that the teachers as well as the administrators and parents are working as a team to make that happen. The other thing that we have done is communication really well with you and I in giving communication out to the parents and to the staff as exactly what cases we had and how that applies. If we do have a positive case, I will say that a case that involves a whole classroom, the Department of Health, Virginia Department of Health, would be contacted by myself, and then we determine what exactly will take place. Thankfully, through that whole time, we didn't have to have a shutdown of, we shut down a couple classes, but it was more out of caution more than it was that VDH even recommended.
Yeah,
so
we're
very cautious people, and it's only because of the safety and health of our staff and students. That's why we do it.
Well, it sounds like we're getting ready to have a very successful school year.
Yes.
You know, with safety in mind as we bring back our students and our staff, and it's going to look like a pretty normal year as far as having students in the building, our extracurricular activities, our sports. We're really excited to bring that back and have a little bit of normalcy for our students.
And I think that normalcy will actually be like going out to the playground and getting to play without your mask on. So I can't wait for that, because they need all that our kids need to be in school, and they need that, not just socialization, but the education that they can get one-to-one and in-person learning is so much better than trying to do it any other way. I know they all work, but this is even better, because they really do get that.
Well, our teachers were definitely rock stars last year.
Yes, they were.
Going from virtual to in-person to teaching
mix.
virtual and in-person at the same time to a few days a week. I mean, that is one of the hardest jobs last year, was being that teacher for our students. And our parents and our families and our guardians, they rocked just as much, because they played the role of the teacher at home. And it truly was a partnership, like you said. And with the health and safety mitigation strategies, that was a partnership as well that allowed us to bring everyone back safely last year and continue that for this year.
Agreed. 100%.
So looking forward to the next few weeks, seeing smiling faces, even if we can see the smiles in their eyes, even though it'll be in their eyes. Yes, exactly. Well, thank you so much for being here. You've been an integral part of all of the planning and all the see-through of it. So thank you so much for being here today.
Thank you for having me.
And thank you for joining us on HCS Connects. It's easy to stay connected with us, so stay tuned and join us next time. Thanks.